Welcome to another tutorial. This is a deep dive into standard medication ordering in Touchworks. This is going to involve going over medication ordering in the standard way without using problem-based orders or care guides, quick sets. That this is a standard medication ordering. Please refer to the problem-based orders video tutorial to really learn how to reduce clicks with medication ordering using the problem-based orders, because certainly that is a key area for click reductions. But there are times when you will have to do a full medication ordering when you're trying to accomplish certain things with a medication, and so we're going to spend some time today going over that. So, ordering medications within Touchworks can be done. You have your clinical toolbar, called the clinical toolbar because it's a way you do clinical work on the patient that's highlighted and showing in the banner bar. So I've selected Alice Test. Alice Test is in the banner bar, and regardless of whether I'm in a note or on the desktop, as long as I have access to this toolbar, I can do some orders. And the RX button on the clinical toolbar maps to the medications area of the orders. The little triangle drop down will break that out a little bit. It'll break it out into prescriptions versus medications that you want to administer in the office. Okay, so if I want to prescribe lisinopril, I put it in the prescription. I can go to directly to the prescription area. That's the default if you press the button. If I want to go to the medication administration area to give some ceftriaxone or give some Toradol, I can use this drop down to go directly there, or I can just click the RX and then skip over to the med-admin section once I'm in there. Okay, so while on your schedule, you can reduce clicks by not going into your note, not going to the clinical desktop, all just by using your clinical toolbar to prescribe a medication. Again, here's the problem-based orders button. See the problem-based orders video to explore that workflow to reduce clicks. We're going to go over the basic prescribing workflow. So let me show you this other venues. So if I go to the patient's chart, let's say I want to see the problem list. I see the current medications. I see that there's actually a medication on hold for administration here that was put in via the medication admin area. And then there's an old antibiotic that didn't come off the chart, which we will talk about that. It's got an alert evaluate status, and it's past the evaluate date. So that's why that's there, but it's an active medication. So from here, see the clinical toolbar is embedded up here. So with the embedded clinical toolbar, I have the ability to click on the RX or go to the drop down and go to one of those areas. The other methods of when you are in a note, as you see here, you also have the clinical toolbar and you have access to the RX button and the drop down. So you see the clinical toolbar, regardless of where you're at in Touchworks, daily schedule, clinical desktop, in your note. You have the ability to prescribe from those areas by going to the RX button. And notice how another learning point within Allscripts is to just be willing to sit there and hover on an item and see what it means. If you don't know what it is, that hover ability for a couple of minutes will teach you what the different buttons mean. So our focus today is on adding new medications. While in your note, you also can get to order new medications if you happen to be down in your assessment and plan area by clicking the new button. That will take you to the orders area or while you're on the med list anywhere within the record, either on the clinical desktop or in the note, you'll notice that you have a new RX button here as well. So many places, either visual, the clinical toolbar, or new buttons in a variety of places. So let's go back to our daily schedule. And then let's click the RX button from there. So this launches this workspace that you need to get used to, the Add Clinical Item, upper left corner, Add Clinical Item. It's a mix of a part of the chart on the left-hand side and then the orders area all on the right-hand side. The chart area on the left-hand side, you have two options to view this. You can view it with these chevrons that open and shut like as such, or you can view this area more like the clinical desktop and the note, where you click the little tiling button and now you have the areas as such. So depending on how long their medication list and problem list is, you might prefer this view as opposed to the chevron view. So it's another good thing to get used to with Touchworks. It's not easily explained, and it's not intuitive. But once you get the hang of it and know what you like better, it will significantly help you. So over here, when we clicked that RX button, it took us to the orders section of the ACI. The other main heading of the ACI is the history builder when you're building problem lists, surgical history, family history, etc. But we're in the order section and we're in the RX submenu. I mentioned the med admin, so right next to RX, this is med admin. If I had gone to the little drop down and select med admin, it would have taken me directly to this tab. The default is it takes you to where you're going to order a medication as such. So as with all orders in the ACI, I recommend working left to right, and working clockwise. So I decide I want to prescribe a medication for hypertension. I select the problem over on the left. Then I come up to the top here. I can even set how do I want it to send that to their retail pharmacy, or send it to their mail order pharmacy? Or is this something I want it to go as a task to the nurse to call it in or to print it? Or if you do have some samples that you know you're going to dispense a sample for, or are you just recording it because it was on the weekend, you called it into the pharmacy and you just want to record it as an order from the weekend. You don't want it to go anywhere. Most commonly, send to retail, send the mail order. Obviously, print RX is also relevant for controlled substances and medications that a patient says they don't know where they're going to get it yet. So searching for medications happens in this box here, but it's what we call an incremental search, meaning that as you type, it will incrementally filter the list to any medications in what's showing, what would be your favorites that match those letters that you're typing in. If the medication you're typing is not in that list, or maybe the dosing is not in that list, that's where you press the enter key. And by pressing the enter key, you will search all the other medications within the medication database and get a more complete get a more complete list of the medications that contain those letters. And obviously it'll take a generic name and apply it to the brand names as well. So your favorites build over time as you order something. If I order something that I hadn't ordered before, then the next time it will show in my favorites. You can add to favorites manually of medications by doing a right click. So if I say, yeah, I'm really going to use a lot of combination of amlodipine olmesartan, I can right-click on that, and I can make it a favorite item. And so now, when I search for olmesartan now, that particular medication is in my favorites. Or I can remove it. Do the right click again and deselect, and it's now gone. Need to find something else. Press my enter key, and now I can see all the items again. So I'm going to click on our 40 milligram olmesartan. This brings up the medication details box. So now we were on the daily schedule. We opened up the ACI, and now we're opening up the medication details screen. It is usually best to maximize this screen as well. So this is where Touchworks gets confusing, because now we have quite a few screens open. This is where the problem-based orders help significantly, because you bypass this screen. It's one less whole pop-up screen if you have that configured properly. But at times, like I said, you are going to have to edit a medication. You have to come to the medication details. And so the medication details screen has the patient's information in this lighter blue bar along the top. It tells you in the upper right what encounter you're currently associating this prescription with. It gives the ability to switch this to a total record without ordering. This one kind of bypasses all prescribing. It's basically you're recording it as if another doctor put the patient on this medication, and so it will gray out any required fields so you can quickly just add the medication to the chart, because you may not know any more detail other than the name, the dose. But we are going to prescribe this medication. Now, you'll notice the next bar down, I have the name of the medication and the tablet size. Let's say I realized, oh, no, I meant to give the 20 milligram. This patient doesn't do well with higher dose medicines. You might be tempted to cancel and then go back and find the 20. That will not save you clicks. The easier thing to do is to go to this drop down, and this drop down will show you the 20 milligram tablet in that drop down, and you can see what other ones are available. It will also have the brand names. But so let's say they say, oh, I've got to have the brand name on this. Even if you choose the brand name here, most the pharmacies and systems will still automatically register it as the generic unless you click the dispense as written button. So remember that dispense as written button. That'll be part of the details here if you're going to go with brand name medications, and you want those to show in your chart as the brand name. But we're going to go with generic 20 milligram olmesartan. Then we have this yellow bar here because we have not provided the details of how to take this medication. There will usually be some details already in here in a list. But if you need to create a new one, you go to New Structured, or if you're doing some kind of a wean or prednisone taper, you can go to Free Text. So if I was going to make it slightly different here, where they're going to take one tablet at bedtime. So now those yellow areas have gone away. If I wanted to make it specifically saying, for blood pressure, $30 tablets. Remember your refills. And then the evaluate, this drop down right here, there's 3 options, 2 of which you will use. For most chronic medications, you will leave it at evaluate. For antibiotics or prednisone, something that's going to be a short-term use, you want to switch this to complete so that it will automatically remove it from the active medications once the number of days is completed. The renew will generate a task to go ahead and renew it for the patient. So pretty rare to use that. So evaluate, and then the date here, after that date, the medication will have a alert circle next to it showing that it's in evaluate status, that the refill should have run out by that time. Remember, we set the send to retail earlier. You can change that here. The patient says, no, I need you to print it. Which pharmacy? Drop down will show you pharmacies. You have the magnifying glass to search. For new pharmacies, the key with the pharmacy search is to know where are you on your personal list, are you on a site list, or do you need to search the entire nation because you're helping someone in another state to prescribe this medication. So just know that if you can't find what you're looking for, it usually has to do with switching to the all. And then you can save a default view as well if needed. Certainly recommended to, when searching the all, that you type in the name of the pharmacy, but then also have some other piece of information like the city or the zip code, which will really help figure out, make the list a lot more manageable when you're trying to find a specific pharmacy. There's the dispense as written again, and then you have the option of this. If this is always the way you want it to be prescribed, you can save that as the default, or you can uncheck that, saying, no, I don't usually prescribe it for bedtime, so I'm not going to choose that. Pharmacy instructions, most commonly what I put in is add refills to profile. Patient's not ready for refills yet, but they're going to be ready before I see them again. I want to go ahead and send it. Not all pharmacies will get these little instruction messages, so I'll be fairly limited in what you put into this instruction area that would go along with the electronic message to them. For controlled substances, residents would have to provide who's ordering the controlled substance so that they have the option of getting the authorization to print that, and it will have to get signed by them. Then you have the ability to do not fill before dates when you're doing multiple prescriptions on controlled substances. And then you also have the ability to replace a medicine right here so that it saves you clicks down the road. If I'm replacing lisinopril, I could have chosen lisinopril here, and then at the same time that it prescribes the olmesartan, it will remove the lisinopril from my chart. Doesn't notify the pharmacy of this information, right? This is just more for the system. It doesn't currently allow us to send any kind of cancel messages through the e-prescribing network to the pharmacies, but this helps just your medication list, and it keeps a track of, oh, I replaced an ACE inhibitor with an ARB. So that will not only clean up your med list, but also keep a record of what replaced what. So I've gotten rid of all the yellow. You can, certainly another area that sometimes people will mess up is that they will link it to the wrong diagnosis. And so you can click the drop down and switch it. Select and deselect items. This one was okay, so I leave it as is, link to order. And save and return. If I still have more orders to do, like my follow-up order, you want to save and return. If I'm done, if I know that I just needed to do this one medication and I need to push through to commit this and send it to the pharmacy, then that's the situation where you do save and close. It saves you a click, and then I can click my commit button, get my last opportunity to verify. Yes, I'm sending it to retail to my test pharmacy, 20 milligrams, 30 pills with 11 refills. That is part 1 of medications ordered ad hoc, where to find the different buttons to order it, how to navigate the ACI to best know the workflow of choosing the diagnosis, choosing the method, and finding the medication, and then the first run through of the medication details screen. So we're going to end it there and look for the basic medication details video part 2. Hope this has been helpful to you, and have a great day.